I'm going to talk now about EMDR, or eye movement desensitization and reprocessing. Dr. Francine Shapiro, the developer of that, was quoted under the heading of disparate neural networks that the working hypothesis for EMDR is that the symptoms of PTSD are caused by disturbing information stored in the nervous system. This information is stored in the same form in which it was initially experienced, because the information processing system has, for some reason, been blocked. Even years later, the rape victim may still experience the fear, see the rapist's face, and feel his hands over her body, just as if the assault were happening all over again. In effect, the information is frozen in time, isolated in its own neural network, and stored in its originally disturbing state-specific form. Because its biological, chemical, electrical receptors are unable to appropriately facilitate transmission between neural structures, the neural network in which the old information is stored is effectively isolated. No new learning can take place because subsequent therapeutic information cannot link associatively with it. Therefore, when thoughts of the incident arise, they are still connected to all the negative attributions of the original event. The results of years of talk therapy, of reading self-help books, and of experiencing counterexamples are also stored, but they reside in their own neural network. It is in part the disparity between this therapeutic information and the dysfunctionally stored information that impels the client into the therapist's office for treatment and has him or her say, I shouldn't be this way. Although combat veterans, sexual molestation victims, and rape victims may know intellectually that they are not to blame for what happened to them, they often continue to struggle with the negative cognitions and disturbing effect. Again, this conflict appears to be due to the fact that the disparate information is stored in separate neural networks. The accelerated information processing model suggests that the moment of insight and integration comes when the two neural networks link up with each other, which is what I believe happens when using the detachment technique, or tapas acupressure technique, emotional freedom technique, and EMDR.